So, as we have been talking again and again, more a compound or a molecule is involved in different pathways, more its pathways are important, more will be its clinical relevance also, because defects always occur in the synthesis of the enzymes which are taking care of these pathways, or because of whatever reason, but clinical implications they have clinical implications. So, for instance, carnitine, as you know, carnitine deficiencies, carnitine is an important molecule as far as the uh, oxidation of the lipids is concerned, especially the oxidation of the long chain fatty acids. So, there are two types of carnitine deficiencies, primary or secondary. Primary is the which primarily occur because of the defects in the transport system of the membranes, because of which carnitine cannot move lipid molecules across the mitochondrial membranes. It prevents the uptake of the carnitine by different tissues, by different muscles like cardiac or skeletal muscle cells, and as a result, the carnitine will be then have to be excreted through the excretory pathway. Of course, the treatment includes the carnitine supplements, which you can get from different pharmacies. Then there is secondary carnitine deficiency, which occurs because of, let's say, defects in the metabolism of the lipids, which acts because of different ailments a patient can have, which eventually lead to the carnitine deficiency. For instance, it leads to accumulation of acyl carnitines, which are excreted into the urine. As a result of this loss through the urine, you will then feel, definitely you will have to face the increase or reduction in the availability of carnitine, which will eventually affect badly the metabolism of lipids. It can also be acquired if you get a liver disease, or if you happen to have a drug which have its side effects which affect the functioning of the carnitine. Similarly, the defects in the mitochondrial oxidation, let's say CPT1 deficiency, it also impairs the functioning of the carnitine. Then medium chain fatty acyl CoA dehydrogenase deficiency is another type of deficiency which happens because of the defect in the synthesis of the enzyme, or some of the important enzymes of the lipid metabolism. The MCAD deficiency is an autosomal recessive disorder. I have told you what is meant by autosomal recessive disorder. You should keep in mind, just ask yourself why most of the diseases you have been coming across throughout this course, why most of them are autosomal recessive. Why not they are autosomal dominant, or why they are not X-linked dominant or X-linked recessive. Most they are found in 1 into 14,000 births worldwide. Of course, not very common, but not extremely rare either. It's occur most of the time in the Caucasians and European people. Severe hypoglycemia and hypoketonuria are some of the symptoms of this disease. Its treatment is that if you can avoid the starvation, it shouldn't be difficult for you why avoiding starvation will help you dealing with this the diseases or defects of the lipid metabolism. You have to just memorize or just think that why, when we were talking about carbohydrate metabolism, and we told you in certain topics that under certain circumstances, when your body is starving, your body moves towards lipid-based metabolism. Finally, the paroxysmal disorders like Zellweger syndrome or X-linked adrenoleukodystrophy, both of these are because of the reason that the peroxisomes are involved in the metabolism of very long chain fatty acids. So if the metabolism is defected, if there is some problem with the metabolism, it can lead to these sorts of diseases also. One of the major effect of these diseases is on the different tissues and different organs. They can be damaged.